आपको अस्पताल में क्यों भर्ती होना पड़ा?
या मुझे ये डायबिटीज़ हो गया, इसके कारण आया।
ये पैर के अंदर कील लगी थी।
शुगर का बीमारी है सर। मुझे तो अभी पता चली।
मोतियाबिंद बता रहा हूँ मैं।
कील लगने के बाद में ये पैर थोड़ा मौत पड़ गई इसमें।
Just now we have seen how patients with diabetes are prone to develop different types of wounds in their feet. Very often they even don't know how important it is to take care of their feet. With passage of time, diabetes patients may develop numbness in their feet, so they don't feel pain even after trauma or burning to the foot. Simultaneously, the arteries get narrowed, which leads to decreased blood flow to the foot. In this situation, there is increased risk of infection. So, patients with diabetes should observe their feet regularly for any dryness, cracks, cut, blisters, etc. And if so, they should contact to the doctors immediately. In this video, we will show you how a patient of diabetes should take care of one's feet effectively. To take care of one's feet, one should clean feet daily. Wash feet with soap and water. Use lukewarm water or keep water temperature according to weather. Take help of others to check water temperature because maybe due to numbness in hands, you are not able to judge temperature correctly and hot water may burn your feet. Do not use brush or stone chips while washing your feet as these may cause trauma. After washing, mop your feet with clean cotton towel or cloth. Mop gently the gap between toes also. Take care not to rub while mopping. Then take help of a mirror to observe your feet properly. Check if there is any cut or trauma. After washing, trim your nails if necessary only with a nail cutter. Do not use blade. While trimming, keep nail cutter straight. Be careful to avoid injury of underlying or surrounding skin. To trim the edges of nails, use nail filer. In this way, you may save your feet from nail injuries. To protect your feet from dryness or cracks, you can apply oil, lotion, moisturizer, petroleum jelly, antiseptic cream, etc. Apply on both top and bottom of your feet. Avoid applying cream or oil between toes as it may increase the risk of infection. To protect from trauma, patients with diabetes should wear socks along with shoes, chappals or sandals. It is more important for those with numb feet. After application of oil or lotion, wear cotton socks. Avoid tight and torn socks. Tight socks may compromise blood flow to your feet. Such loose socks are appropriate. You can protect from injuries to your feet by using socks, sandals and shoes. Wear chappals, sandals and shoes such that it should be broad from front. Do not use shoes like this which is narrow from front. Avoid wearing such chappals which has a tape in between toes. Due to recurrent friction of skin in between toes with the tape, there are chances of injury to the skin. The whole thing may go unnoticed to a diabetic patient because of numb feet. If your feet are numb, then use such chappals which can be tightened or loosened from back according to need. Sometimes diabetes patient can't sense whether he or she is wearing a footwear or not, or it is already slipped away due to numbness of feet. That's why they should wear chappals which can be tightened at back. Diabetes patient may have swelling often in their feet in the evening. So they should purchase footwear in the evening so that it may fit even in presence of swelling. One must wear socks before having footwear. It is essential to look for pebbles, insects, etc. inside the shoes which may injure your feet. Diabetes patients are often unaware of their feet injury because of numbness. So one should be careful in places with excessive heat or cold. For example, silencer of motorbike or walking on fire. If you want to visit places of worship on barefoot, prefer morning or evening hours. Avoid going to such places in the midday when the temperature of the floor is very high due to sunlight, as it may cause foot injury from heated floor. Do not use hot water bottle to warm your feet, and do not sit in front of room heater because it may burn your feet without your knowledge due to numbness in the feet. With time, there is narrowing of arteries in patients with diabetes. It occurs more rapidly and with increased severity when one smokes or consumes tobacco. This leads to poor blood flow and delay in healing of wounds. Sometimes it takes 2 to 3 months to heal. In few situations, wounds do not heal at all. That's why patients with diabetes should not consume tobacco in any form. In fact, they should quit tobacco immediately. Diabetes affects kidneys and eyes as well. So it is important to have regular checkup of kidneys and eyes. Hope after seeing this video you will take care of your feet appropriately.